The Rio Games may be history, but we're still talking about Michael Phelps and all those Olympic medals. Simone Biles and her tiny but powerful punch. And also on the radar, Aussie hurdler Jenneke. It isn't her Olympic debut on the field that has people chatting, but rather her perkier-than-usual bosom. And while she isn't saying if she did or didn't get breast implants, Jenneke doesn't seem to mind the world is focused on her new cleavage.
She's a great example that you can be an athlete at the very highest level and still enjoy the contours of your chest.
Plastic surgeon Dr. Clifford Clark says Jenneke is far from alone. He's seeing more and more fit female athletes.
We see CrossFit athletes, bodybuilders, people who just enjoy the gym.
Clark says fit women who work out still want curves, but do require some special thought before the surgery.
We think long and hard about size, position, which is whether they go above or below the pectoralis major muscle. That might have implications as to what type of physical activity they use. And so an athlete has their own specific nuance and considerations, but it's well within the norm of most very, very vigorous female athletes to have breast implants.
We really have come a long way. It wasn't that long ago breast implants were considered off limits except for women who made their living as exotic dancers. Well, that's changed. Now breast implants are for any woman who wants to feel better about herself. And that, of course, includes athletes.
There's no reason to isolate athletes.
Dr. Bruce Van Atta is also seeing a growing number of fit women seeking bigger breasts.
I personally have had experience doing bodybuilders, serious bodybuilders.
Van Atta says it's always a decision whether to place the implant above or below the pec muscle, and that depends on the patient. But he says athletes, even those with very low body fat, are good candidates for breast implants.
Often, you think about it, they're very thin. Sometimes that body fat may be in single-digit level. And so their breasts don't have the fullness. And it's natural for them to want to have some feminine shape to their chest. And the breast implant is a great option.
That's the beauty of being an athlete. It might be at the elite level or someone who likes to push iron at the gym. Staying in shape doesn't mean you can't still consider a cosmetic surgery. It's all part of being a woman. Options.
It's become a very important and accepted part of femininity and feeling good about yourself.
For the Plastic Surgery Channel, I'm Dawn Tongish.